one of the really bad effects of alcohol, but that's extremely well documented, is the fact that alcohol, because of this toxicity, can alter DNA methylation, it can alter gene expression. That can be many things in different tissues, but it is associated with a significant increase in cancer risk, in particular breast cancer, because breast tissue is present in both males and females, but in women, it's especially vulnerable to some of the DNA methylation changes. Well, breast cancer in women has a relationship to alcohol intake, and alcohol intake has a relationship to breast cancer in women. In fact, there has been proposed to be anywhere from 4 to 13% increase in risk of breast cancer for every 10 grams of alcohol consumed. There have been studies of the percentage of alcohol included in different drinks and the sizes of different drinks that are served in different countries. In Japan, 1 beer, 1 glass of wine, or 1 shot of liquor as it's served there tends to include anywhere from 7 to 8 grams of alcohol. In the US, 1 beer, which generally is 12 ounces, if it's in a bottle, 1 glass of wine or a shot of liquor tends to include about 10 to 12 grams of alcohol. And in Russia, 1 drink of the various sorts that I just described typically will have as much as 24 grams of alcohol. Of course, there are other countries in the world. Those countries are also vitally important, but those are the ones that I extracted from the studies. What does this mean? Well, what we're talking about is that for every 10 grams of alcohol consumed, there's a 4 to 13% increase in risk of cancer. But the point is that the more alcohol people drink, the greater their increase of cancer, in particular breast cancer. And that's because of the fact that alcohol has these effects on cells that include changes in gene expression. And cancer, that is the growth of tumors, is a dysregulation in cell cycles. Right? A tumor is an aggregation or the proliferation of cells. Cancers proliferate and take hold and cause serious problems when the proliferation of cells exceeds the immune system's ability to gobble up and remove those cells. And alcohol hits it. Again, it's a 2-hit model. It increases tumor growth and it decreases the sorts of molecules that suppress and combat tumor growth. There are things that people can do to at least partially offset some of the negative effects of alcohol as it relates to predisposition to the formation of certain kinds of tumors and cancers. And the 2 things are consumption of folate and other B vitamins, especially B12. The consumption of folate and B12 has been shown to decrease cancer risk in people that ingest alcohol, but not completely offset it. Not incidentally, a lot of the reported hangover supplements and treatments include folate and B12. It does appear that decreased folate and other B vitamins like B12 are partially responsible for the effect of alcohol in increasing cancer risk. And it does appear that consuming adequate amounts of folate and B12 might partially, really want to boldface and underline and highlight, partially offset some of that increased risk.